My name is Struhl. I'm an orthopedic surgeon. I work at a solo practice in Manhattan, and I work at NYU Langone Orthopedic Hospital. Most of my practice is shoulder and knee arthroscopy, and I've been in practice for about 28 years. What I find is patients want more accurate information than the MRI, and they want something they can connect with. The great thing about the IntraVu scope is it's a great exchange for small size, for video quality. The better the quality, the better the patient truly can connect with what's going on. The quality you get here, you can see real anatomy and you can explain it. So when they see video evidence of what is actually going on with the inside of their knee or shoulder, they digest that information better and they're more comfortable acting off of that information. Patients come to see me and they want to know what's wrong with their shoulder. I'll say, well, you can have an MRI, or I'll say there's another alternative. We have a needle arthroscopy and we could look in your shoulder right now and tell you what's going on. So, because we're doing it in the office setting, it's not surgery. The needle is the same size as a needle I would give them if I was injecting their knee, cortisone or something else. For the invasiveness of a single needle, I get this powerful video information. And within 15 minutes, they have their answer. There are things that the MRI is not particularly good at. Anytime someone's had previous surgery and they have pain or problems or just want to know what the status is, it's a much more accurate tool because MRIs are difficult to interpret in the postoperative condition. So this is direct, visual, powerful information. And there are people who just simply can't have an MRI. All these patients, they have no diagnostic tests other than surgery. In my practice, I do regenerative injections, stem cells, and PRP, and patients want absolute assurance that you put the medicine where you said you put it. A lot of people use ultrasound, but this is a powerful tool because you not only can see where the medicine is going in, but the patient gets information about the joint of what's going on. And you could do targeted injections too. You could inject the regenerative injection right into the tissue itself, or meniscus tear right into the meniscus tear itself, where it'll be more concentrated. I do arthroscopy not using a liquid medium, which is the typical way to do it, but I use air or gas arthroscopy. The gas has a number of advantages in this device, in this setting. If you're using this technique to do joint-confirmed biologic injections, if you're using PRP or stem cells, you really don't want to be diluting that in a large amount of saline that you've used to see the inside of the joint. With the gas, you just put the scope in, inject the air, and inject the injectable, and it's as if you didn't do the scope at all. A lot of times people, especially for shoulder surgery in particular, want to know information about what to expect after surgery. The MRI gives us the information that says you need surgery, but the MRI often is not accurate, and I'll say to a patient, it's probably going to be a quick recovery, but you might have other things that make this more difficult. And now the patient doesn't know whether they're going to be in a sling overnight or for several weeks, and that's a big deal. By doing the needle scope, even on somebody that we know is having surgery, we can tell them with precision exactly what we're going to do, and they want that information.